Hi, Kevin. It's good to see you again. Glad you could make it.
Hello.
We've gone over the assessments that you completed with us prior, and we just want to walk you through the results and talk about what they mean. And it's also open for you to ask any questions if you don't understand anything, all right?
All right.
Yes, Kevin, thanks again for coming in. We appreciate this time with you. So I just wanted to indicate that the goal for today is to help you better understand your strengths, areas where you might be struggling, and some next steps we might consider to support your goals. So let's just start with the general test results, and then we'll walk through each specific area.
Yeah, so the general measure of your intellectual ability, we use the test called the Kaufman Brief Intelligence Test, or the KBIT. And your verbal IQ was in the average range, meaning your verbal reasoning and vocabulary skills are right where we would expect. However, your nonverbal reasoning, which involves skills like problem solving using visual information, was a bit lower, in the below average range. That's not unusual, and it doesn't mean that you can't reason through problems. It just suggests that you may benefit from a more visual or hands on approach when learning or solving problems.
And again, I just want to remind you that you're more than welcome to ask questions and stop us at any time.
Yep.
We also gave you an academic test called the RAT5, WRAT5. This measures skills like reading, spelling, and math. And it was noted that the majority of your scores fell within the average range in all categories except for math. And in math, you scored a 78, which falls below the average, which indicates that you may struggle a little bit with math.
That's news to me. I was an accountant.
I want to let you know that it doesn't necessarily mean that you're not good at math or that you can't do math. It just simply means you might benefit from additional tools that might make you a little bit more successful in that area. And how we take in information is different across all boards.
And like on the assessment day, if math was your lower score, maybe you just had a bad score with math that day. So we're welcome to explore these scores more later in therapy, all right? But the next assessment is the Tennessee Self Concept Scale. And we noticed that your overall self concept, including personal, academic, and moral self views, was lower than average, particularly in how you view your abilities and worth. You scored high in self criticism, and that tells us that you may often be very hard on yourself, especially when you feel like you're not meeting your own expectations.
There were also strengths that we noticed here. You rated your family and social self concept higher. And this could indicate that you care deeply about your role in your family and how others see you. And that sense of responsibility may be both a motivator and a source of stress. In therapy, we could definitely work on this together, reshaping how you view yourself from the inside out and not just how others might see you.
Mm-hmm.
Okay.
On the
Okay.
next on the next assessment, on the Beck Depression Inventory, your score was in the moderate range for depression, and that just means that you're maybe experiencing symptoms like low mood, fatigue, feeling hopeless more days than not. And this is something that we take seriously, and it's something that in therapy we can work with, like cognitive behavioral therapy might be really beneficial for this for you. All right?
Okay.
You also scored in the moderate range in the Beck Anxiety Inventory, which tells us that symptoms like worry, tension, or physical signs of stress may be affecting you on the regular. With the amount of pressure you're carrying, especially trying to hide your job situation from your family, it is very understandable that anxiety might be a part of what you're experiencing right now.
Mm-hmm. Another assessment that we did was the STAXI, which looks for anger. And your scores indicate that you tend to internalize anger and may struggle to express it in a way that feels safe or healthy. And that can build up to, frustration and tension. And it could explain some of the strong reactions that you've had in the past and that are having right now, with your work situation and your family situation. And again, therapy can better explore ways to recognize this and work through your anger before it boils over.
That would be nice.
Yeah.
Definitely. We also gave you the audit, which looks at alcohol use. Your scores suggest you're in a moderate risk range for problematic drinking. And this doesn't mean that you have an addiction, but it does mean alcohol could be becoming a way to cope with stress, which can get risky if left unaddressed. And we're not here to judge, just we're just looking for ways to explore on how we can manage what's currently going on in your day-to-day life.
Mm-hmm. So all these assessments kind of get, put together like puzzle pieces in order to understand what we need to explore later in therapy and what kind of therapy that you would benefit from and that you would need. So, based on all of this, our first recommendation to you is to begin cognitive behavioral therapy. It's also known as CBT. And CBT can help you reframe these thoughts that are fueling your depression, the anxiety and the self doubt, and give you tools to manage stress and regulate your anger more effectively. That way, it's not taking you over and disrupting things in your day to day life and the things that you've been facing, you know, just recently. Okay, CBT really does let you explore how to do things in a more creative outlet.
Our second recommendation is that you schedule an appointment with a psychiatrist to see if medication could help you manage the depression and anxiety that you're feeling. That's something you would have full control over and it would be entirely your choice. But it might be worth exploring, especially given the emotional weight that you've been carrying.
And if
Wow,
you,
it's just. Oh, sorry.
yeah,
Sorry.
no. It's a lot. It's a lot to take in. Um, like she said, the medication management would be totally in your control. And you talk all that over with the psychiatrist to find out what would better work for you and your needs and what you need. It's all about you, what you need in this situation.
And again, if you meet with them and you choose not to go the medicine route, that's okay too. We're here to support whatever you need.
Mm-hmm.
Thank you.
You're welcome. And then one last thing, continuing, is that we'd also recommend that you maybe get a couple more assessments. There's one called the Perceived Stress Scale. It's also known as the PSS. And that's going to give you a clear picture of your day to day stress levels. Um, instead of focusing maybe on one big stressor, you can narrow down your day to day stressors. That's what that's going to give you. And there's another one called the CAGE, CAGE questionnaire. And this looks more closely at how alcohol might be functioning in your life. Because, like we said earlier, you're not necessarily an alcoholic, but the scores do seem to indicate that you might be using alcohol to cope with these stressful situations that are going on. So that's going to give you a clear picture of how the alcohol plays into the functioning of your life.
And Kevin, we know this is a lot of information, and we appreciate how open you've been during this entire process. We know you did not volunteer to be here on your own. These results don't define you, so I just want to make that perfectly clear. They just give us a better picture of a starting point. And I just want to remind you that you're not alone in this. Crystal and I are here to support you in any way you need.
Mm-hmm. Yep, you're definitely not alone. That's right. And everything we talked about today, it can be addressed later on. Don't, if you have a question later on, always ask your questions. That's perfectly okay. Like I said, it's about you and your path and your growth. So you have strengths that we can build on, and together we can, work towards helping you feel more balanced and supported and in control. And do you have any questions for us before we wrap this up?
Um, I'll need provider recommendations, but I don't think I have any questions right now.
Okay, yeah, we can get you some recommendations for some providers and anything you need like that. We can help you out with that, all right?
All right.
All right. Well, it was
Great.
good
Thanks for your
seeing you.
time,
Yep,
Kevin.
thank you.
Thank you.